Venous drainage of the head and neck, and this particular topic, which is about the thyroid gland venous drainage. We see that there are three veins which are going to drain the thyroid gland, and the names are accordingly the location wise: superior, middle and inferior thyroid veins. Now you will find that the superior and middle thyroid veins, they are draining into the internal jugular vein. The superior and middle thyroid veins drain the venous blood into the internal jugular vein, whereas the inferior thyroid vein, which are near the midline, are draining into what is called as the brachiocephalic vein. If it is on the left side, left brachiocephalic, or could be right brachiocephalic vein. Actually, these brachiocephalic veins are supposed to join together to form superior vena cava. So ultimately the blood will be drained into superior vena cava via the brachiocephalic vein. This time it is left side. Now you have to understand that when we are doing emergency tracheostomy, and when we are cutting the isthmus of the thyroid, it's a midline incision, you have to be careful about these veins which are inferior thyroid veins because they are near the midline. And also about this vein. Which one? The left brachiocephalic vein. It is also at risk of injury in emergency tracheostomy. Why? Only the left side. Why not the right side? Because it is the left brachiocephalic vein which is crossing the midline. And why it is crossing the midline? Because this left brachiocephalic vein has to cross the midline to enter the superior vena cava, which is on the right side of the midline. But why the superior vena cava is on the right side of midline? That will be the embryology of vena cava, but understand that superior vena cava is present on the right side of midline. So obviously the left brachiocephalic vein will become longer and cross the midline, and it is more oblique as compared with right brachiocephalic vein. And since the left is crossing the midline, it was prone to injury in emergency tracheostomy when you were cutting the isthmus of the thyroid gland. So be careful about this vein. Now you will see that there are some lymphatic drainage channels in the head and neck, and they are called as the jugular trunk. So there will be jugular trunk on the left side, and there will be jugular trunk on the right side. Now right jugular trunk, or maybe the left jugular trunk. Why they are called jugular? Because lymphatics follow veins. So if you say lymphatics follow vein, means lymphatics were following the internal jugular vein. Yeah, actually lymphatics follow external jugular vein and also the internal jugular vein. So lymphatics which were following these jugular veins, they are forming some jugular trunk, where the jugular trunks are going into the junction of the neck veins. So as we see, these jugular trunk are going to drain into the junction of the neck veins. What is the name of the duct which are opening? Actually, you have to understand, jugular trunks are going to drain into the thoracic duct on the left side, and thoracic duct itself will drain into left venous angle. Now, what is this left venous angle? Left venous angle means it is the left jugulo-subclavian venous angle. Are you trying to say that there is a junction of the two veins here? Yes, one coming from the upper limb, which is called as the left subclavian vein, and one is coming from the head and neck, which is called as the internal jugular vein. So there is the left internal jugular vein and joined by the left subclavian vein. So that is why it is called jugulo-subclavian venous angle. It is also the beginning of the left brachiocephalic vein. So that is where the thoracic duct will open. Yes, and what was opening into the thoracic duct? That was the left jugular trunk. So you are telling that the neck lymphatics are draining into the left jugular trunk, and the left jugular lymphatic trunk will drain into thoracic duct, yes, and into left venous angle. What about the right side? If you say right side, then you have right lymphatic duct opening into right venous angle, which is the jugulo-subclavian venous angle in the similar fashion. So what is draining here? Actually, we have the right jugular trunk draining the lymphatics of the right side of the head and neck region, and right jugular trunk drain into right lymphatic duct. So head and neck region on the right side will drain the lymphatics into the right jugular trunk and into right lymphatic duct into right venous angle, which is also the beginning of the right brachiocephalic vein. This is the diagram which we are supposed to draw now. Let's draw the diagram. But before we draw the diagram, we should have some additional information. Like, if you remember, we have discussed that the cranial cavity drains the venous blood into internal jugular vein, which is a continuation of the sigmoid sinus on each side. So we have sigmoid sinus on each side, yes, and this sigmoid sinus is going to continue as the jugular vein, yes, internal jugular vein. Now understand that this is called as the jugular foramen. Jugular foramen means where we have nerve number 9, 10, 11. Yes, you have got nerve number 9, 10, 11, but it is also internal jugular vein, beginning of internal jugular vein. So we are telling that in the jugular foramen we have nerve number 9, 10, 11 and beginning of the internal jugular vein on each side, yes. And it is receiving the first tributary into it. If you say it is receiving the first tributary into it, means the inferior petrosal sinus. Yes, remember, inferior petrosal sinus, which was draining the cavernous sinus into the internal jugular vein. Cavernous sinus will drain the blood into inferior petrosal sinus into the internal jugular vein. That is also a content of the jugular foramen. So in the jugular foramen you have nerve number 9, 10, 11 and also the beginning of the internal jugular vein and also the first tributary of internal jugular vein, which is called inferior petrosal sinus. Now this internal jugular vein has brought the blood of head and neck. Where is it going to drain? Actually, internal jugular vein will join the subclavian vein of the right side as well as left side, so that together they will form brachiocephalic trunk on the left and brachiocephalic trunk on the right. And the left brachiocephalic vein is longer, more oblique, crossing the midline to enter into superior vena cava, which is on the right side of the midline. And what about the thoracic duct? Thoracic duct is a lymphatic duct which is draining into the left venous angle, and right lymphatic duct. Right lymphatic duct is draining into the right venous angle. And what about the other veins? Other veins, you have to understand, there is external jugular vein which drains into the internal jugular vein on both sides. And what else is draining into the internal jugular vein? You remember external carotid artery giving branches? So corresponding branches of external carotid artery, it gave 8 branches, remember? So you mean to say occipital vein and the pharyngeal vein and the facial vein, lingual vein, thyroid vein? Yes, this is what you have to remember. They all drain into internal jugular vein. Let's draw the diagram. So this is the midline of the body, yes. And where is the head and neck draining? Head and neck, maybe on the right side or left side, will drain into internal jugular vein. Now if you say this is going to be the internal jugular vein, which is right-sided, and there will be also left-sided. So left-sided internal jugular vein. What is draining into this right and left internal jugular vein? The blood of the head and neck region, like thyroid veins we have discussed earlier. Okay, fine. Now if you say so, what is the first tributary? First tributary we have already mentioned. It was here, and it is called inferior petrosal sinus, draining the cavernous sinus. And both of them are inside the jugular foramen on both sides, maybe right side or maybe left side. Okay, if you say so. What is the next thing? Next thing is we have to tell the right upper limb is draining the blood into the right-sided subclavian vein. So this is going to be the right-sided subclavian vein, yes. And what is this right-sided subclavian vein draining the upper limb towards? Actually, it will join the internal jugular vein so that together they can form the brachiocephalic vein. This is the right-sided brachiocephalic vein. If that is the right-sided brachiocephalic vein, then what about the left side? It is the same pattern, mirror image. If it is mirror image, then you can tell that this is going to be the left upper limb drainage. Yes, left upper limb, which is draining into left subclavian vein. So left upper limb draining to left subclavian vein and is joined by the internal jugular vein, so that together they can form the left brachiocephalic vein. So you're telling this is the left brachiocephalic vein which is crossing the midline? Yes, actually left brachiocephalic vein is long and more oblique and cross the midline of the body, so that it will join the right brachiocephalic vein and together they can form what is called as the superior vena cava. Superior vena cava embryologically is present on the right side of the midline. This is the midline of the body. So the superior vena cava embryologically is present on the right side of the midline. Yes. Okay, fine. Then what about the thyroid gland draining? Thyroid gland we have discussed. This is the thyroid gland, and we were actually cutting the isthmus of the thyroid gland so that we can do emergency tracheostomy. But that time when we're doing asthmectomy for tracheostomy, we should be careful because this vein is at risk of injury. Which vein? The left brachiocephalic vein. We have discussed because it is crossing the midline. And not only this vein is compromised, can be compromised, but also one more set of veins. And what is that? If you remember, we have discussed that there is superior thyroid vein draining into internal jugular vein, middle thyroid vein draining into internal jugular vein, but the inferior thyroid veins drain into brachiocephalic vein. Now, if the inferior thyroid veins drain into the brachiocephalic vein, can they be compromised in case of emergency tracheostomy? Yeah, that is a question already. Understand, while doing asthmectomy, there are midline structures which are compromised and could be inferior thyroid veins draining into brachiocephalic vein. I am showing only two vessels, but there are multiple vessels. Inferior thyroid veins are there, multiple vessels are there. I have shown only two of them. So this is superior thyroid vein, yes. Middle thyroid vein, yes. And they drain into the internal jugular vein, correct. And whereas the inferior thyroid vein drain into brachiocephalic vein of the left side and right side also, of course, they can drain into the right side also. That doesn't matter. I told you there are multiple set of network of veins will be there, in fact, in this region. And what about the lymphatics? Lymphatics we have discussed that if it is the right jugular, this is the left jugular trunk, then left jugular trunk should drain into the thoracic duct. And where the thoracic duct should drain? Thoracic duct should drain into this angle. And what is that angle called? Left venous angle. So left-sided lymphatics will drain to left jugular trunk, will drain to thoracic duct, will drain to the left venous angle. What about the right-sided jugular trunk? If you say right-sided jugular trunk, which will drain the right-sided lymphatics of the head neck region, drain into right lymphatic ducts. And where is the right lymphatic duct draining? Into this angle. And what is this angle? That will be the right venous angle. That is the right jugular subclavian venous angle, which is also the continuation. It is the beginning of right brachiocephalic vein.